Can you tell me your name and what city you're from?
My name's Terry, and I'm from Livonia, Michigan.
All right, Terry. What kind of problems led you into this office?
Back pain and pain going down my side, down my leg, from my back, and my knees.
Okay. And so you had back pain, you had sciatica. How long was that going on?
Oh, probably almost a year.
Almost a year?
Yeah.
And your knee pain, how long was that going on?
I guess it's been going on for quite a while, but it just got worse.
Okay. And so you had stem cell therapy done about 4.5 weeks ago.
Right.
What have you noticed since then? How was your back pain?
The back pain's gone.
And what about that
pain,
sciatica?
That's gone.
And what kind of improvement are you getting with your knees?
The right knee's not, that's not bothering me like it did, but the left one is.
And
but
what percentage are you?
It's like 75%.
75% improvement. Now, are you able to do things now without the pain that you used to have before?
Yes, it's a lot.
Or less pain, I should say.
A lot easier, yeah.
What are you noticing? Like stairs a little bit easier?
Yeah, a little bit, yeah.
What's the thing that you do now more than anything where you could say it's a lot easier that you notice the most? Is it walking, stairs? What would you say?
Yeah, probably walking down the stairs. Yeah, and before I had stand there washing dishes, then my back would hurt. But now I can do it.
Now you can do it without having all those problems. That's wonderful.
Yeah.
Thank you very much for this testimonial. I appreciate it.
Oh, you're welcome.
Have a great day.
You too.
All right, can you tell me your name, please?
My name is Norma.
And Norma, what city are you from?
I'm from Rochester Hills, Michigan.
All right, Miss Norma. So tell me, what kind of problems were you having before you actually came in to see us for the stem cell therapy?
I was in 24-hour-a-day knee pain, and it was greatly inhibiting my activity. I was becoming a couch potato, gaining weight. I didn't want to vacuum. I didn't want to go to the store even or go shopping because my knees were in pain all the time.
So it was both of them?
Yes.
Now, had you seen some people before you came in here?
I had surgery on my right knee probably 5 or 6 years ago.
Okay, how'd that work out for you?
For a meniscus tear.
Mm-hmm.
It was somewhat successful.
Okay.
But was still having pain with the knees. I've been using orthotics in my shoes for years to keep my knees in line right, but that wasn't fixing the problem either.
Okay. And how was this affecting you, let's say, on like a daily basis, things you would like to do, stuff like that? What were you noticing before you came in here?
Well, I was noticing I would avoid things. Like I would avoid going upstairs until I had 4 or 5 things to get. I would avoid getting in lines at the post office. I just couldn't stand there and wait.
Okay.
Now I can.
Any activities you'd like to go through or anything that you would normally do that now you're having to either stop doing it or you'd have to like decrease it or limit it?
Well, I'm walking my dog much farther now, and we walk much quicker, more briskly. And I'm thinking about taking up golf again this spring.
Well, when's the last time you were golfing now?
3 to 4 years ago.
Because of the knee issue?
Because of the knee issue, yes.
Okay. And so you said you're walking the dog longer. What other things can you do at home?
Well, I'm still not real big on cleaning, but I prepare meals with much more intensity because I could stand, I could move around my kitchen. Gardening, I had to have a helper with gardening with the digging. I can do that myself now. So.
How are you doing with stairs now? What was that like before? What's it like now?
I was dragging myself up with my arms, but now I just walk up, even carrying laundry, lots of stuff. It's 100% improved.
Excellent. Well, thank you very much. I appreciate that.